Hello and welcome. In this video we will look at C.diff and how it's caused. Hopefully your questions will all be answered here, but if you need any further information please feel free to visit our website at www.cdiff-compensation.co.uk. First of all, let's look at how a C. diff infection occurs. This happens when a C. diff microorganism grows out of control in the gastrointestinal tract, the GI. Ordinarily, this kind of microorganism is harmless and actually can help in the digestion of food and nutrients. As such, we all have this kind of microorganism in our body, and surprisingly, C. diff can be present in around 3% of healthy adults. But a C. diff infection occurs when the C. diff microorganism begins to grow out of control, resulting in severe infectious diarrhea and inflammation of the large intestine. This can happen to hospitalised people, and the presence of C. diff in hospitalised adults is 10 times higher, that's up to 30%, than in ordinarily healthy adults. A C. diff infection is by far the most common cause of diarrhea found in hospital patients. But why are patients so susceptible to a C. diff infection? Basically, a C. diff infection occurs when a body's preventative bacteria is not strong enough to stop the C. diff from outgrowing the GI tract. This happens for a number of reasons. Firstly, a long stay in hospital. The potential for C. diff spreading in a clinical environment is very high, and combined with the stress a patient will be under and the illness-weakened body a hospital patient is a prime candidate for C. diff infection. Another important factor is age. C. diff is obviously an infectious disease, and, as in all diseases of this type, the elderly are much more susceptible because their immune systems are weak, especially when hospitalised. Illness. Any serious or constant illness will weaken the body's immune system and will therefore increase the risk of a C. diff infection. Antibiotics. This is surprising, but a very real risk to a patient in a hospital environment can be posed by antibiotics. This is because antibiotics can kill the bacteria which controls the growth of a C. diff. A patient then becomes susceptible to a C. diff infection. I hope that's answered some of your questions, but to learn more about C. diff infections and how you can make a compensation claim if one of your family or yourself has been unfortunate enough to be exposed to this disease, then please visit our website at www.cdiff-compensation.co.uk.